Hello and welcome to the channel. Today I'm going to be looking at this paper from Curious titled Assessment of Serum Ferritin Levels in Female Patients with Telogen Effluvium. I wanted to look at it as an example of issues in dermatology research. The paper is a case control study, which is a commonly used study method in dermatology. I used to think papers like these would get little traction. These are more obscure journals. If there are flaws in these papers, it might not matter because no one's reading them. No one would use papers like these to make decisions about a patient's health. But I've changed my mind about that. Firstly, because of how many meta-analyses are published, where even poor quality research with questionable conclusions might get added into a meta-analysis and suddenly it finds its way into a higher tier journal and therefore influence patient care. And secondly, because I've been making these videos and posting them, social media algorithms are throwing my way posts from influencers promoting these papers. Here's an example of an Instagram post promoting this paper. It's from an account that belongs to a world-renowned hair expert. Why do I say it's a world-renowned hair expert? Well, it says it right here in their bio. World-renowned hair expert with thousands of followers. And promoting these papers gets lots of attention. So then it does have the ability to influence doctors and the public. I figure if papers like these do get attention, then it's fair game to critically appraise and comment on them. So let's take a deep dive into it. Here's the abstract of the paper. The authors describe their study as a cross-sectional comparative study involving 100 female patients, 50 with telogen effluvium and 50 controls. Then serum ferritin was measured in both groups. They found serum ferritin significantly lower in cases compared to controls. So the conclusion, low serum ferritin is significantly associated with telogen effluvium in women. Serum ferritin may serve as a useful biomarker for identifying iron deficiency in patients presenting with diffuse hair loss. I mean, no one could dispute the first half of that sentence. Of course, serum ferritin is a useful biomarker of iron deficiency, but that's not why we're doing this study. The point is it associated with telogen effluvium? That's the point of the study, not whether it's a marker of iron deficiency. We're interested in the dermatology, not the hematology in this research. This is the study methodology. I haven't edited it. This is the entire study methodology. 4 paragraphs to describe everything the researchers did, starting again by describing their study as a cross-sectional comparative study. But is this a cross-sectional study? In a cross-sectional study, you select 100 subjects, preferably consecutively. Then you measure how many of these 100 people have telogen effluvium and what everyone's ferritin is. In other words, you measure both variables simultaneously in the population, a cross-section. But in this study, 50 patients with telogen effluvium were selected and compared against 50 controls. Assuming telogen effluvium is the outcome and ferritin status the exposure, then by selecting based on outcome and measuring exposure, by definition, this is a case control study. They were always going to have 50 patients with telogen effluvium in the study because they selected 50. In cross-sectional studies, you don't select for exposure or outcome. Now you might say, why does this matter? Who cares what study type it is? Does it influence the results? Is it just being pedantic? I'll tell you why it matters. When you have a research question, you design the study that best enables you to answer the question, taking into account practical limitations, resources, ethics, and so forth. But that means you must understand all the different study designs out there, because different study designs have different advantages and disadvantages. And the design would depend on whether your question is looking at etiology, risk factors, prognosis, intervention, associations, and so forth. There's a common misconception that evidence-based medicine is just about randomized controlled trials. If it isn't a randomized trial, it can't be a good study, or the best way to answer all questions is to do a randomized trial. But that's ridiculous. If you're studying risk factors, a randomized trial would be a very poor way of studying the issue. Can you randomize someone to smoke or to be overweight? So while case control studies have their flaws, they are still an important way to study some issues. If case control studies have a bad rep, let me say it's more because they are often badly done. A well-designed and executed case control study is still a valuable study design. It's just that we hardly ever see a good one. Coming back to our study then, there's a lot that goes on in research beyond what is printed in the paper. We have to trust researchers are doing the right thing, to have made the right decisions, to have analyzed the data correctly, because we don't have access to the raw data. We must trust what the authors are saying. So while it may seem pedantic, if the authors don't understand the difference between study designs, it erodes confidence that they understand the more complex issues relating to data collection and analysis. It's an issue of credibility and confidence. And when we're critically appraising a piece of research, correctly identifying the study method helps us quickly identify where the likely sources of error are going to be. Because as I said, every study method has its strengths and weaknesses. In case control studies like this one of the critical areas to examine is the control group. In case control studies, the control group is really important. I'd go so far as to say it's the most important aspects of these types of studies. Why? Well, if you think about it, the control group is what makes a case control study so much better than, say, a large case series. Without the control group, then your cases are just that, a large case series. It stands to reason then that the quality of your control group, who they are, how you select them, will determine the quality of your case control study. Say you're examining the association between non-steroidal anti-inflammatory agents and cancer. If your control group comes from the rheumatology clinic, those controls might have an abnormally high rate of non-steroidal use. But if they come from the gastro clinic, they might have a lower than normal rate of use. So when you're critically appraising a case control study, you really want to examine the characteristics of the control group. What do we know about the control group in this study? Absolutely nothing. The reason I pasted the entire methodology description here is to show you that in the entire 4 paragraphs, we know nothing about the controls. Who are they? How were they selected? From people attending the hospital? From the dermatology unit? Another specialty unit? From the general public? Nothing at all. I made the point earlier that if you're a researcher that understands study design, you would know why describing the control group is essential. If it's not there, either the researcher doesn't know why it's essential, which then compromises our confidence in the control group that was selected, or the researcher does know, but deliberately left it out of the description, which is arguably worse. I won't accept the argument that space limitations make the researchers leave out descriptions of the control group. The study methodology is the most critical part of a manuscript. If you're going to cut out detail here, what's the point of the rest of the paper? Here's the introduction section of the paper. All these words, another 4 paragraphs, and as long as the whole methodology, they do nothing to tell me whether this study is any good or not. If space limitation really were an issue, this would be the first section to cut. Here we see the first big problem with the control group. Remember, the control group needs to be as similar to the cases as possible, except for the factor under study, which in this case is telogen effluvium. Otherwise, if the control group is different in some way apart from the factor under study, that introduces confounding to your results. Here you see 26% of cases had menstrual irregularity, as opposed to 8% in the control group. 3 times as many subjects with menstrual irregularity. What does menstrual irregularity mean? I don't know, it's not defined. But what it means is that in the measure of association, perhaps it's not ferritin that's associated with telogen effluvium. Perhaps menstrual irregularity is a confounder, and you're measuring the association between ferritin and menstrual irregularity between the groups. That certainly seems plausible to me. That's what confounding means, and that's why proper selection of control groups is essential. Here's the next big problem when we look at the control group. In the control group, not a single woman had low ferritin levels. Now, reduced serum ferritin is defined as less than 15, but based on that definition, not a single woman in the control group had low ferritin. That is quite a healthy group of women. And the question, therefore, is how representative is the control group of what we would expect of most young adult women in India? I did a quick search of studies of iron deficiency in Asian women, and of course, it's a difficult area to study with so much variation in different Asian countries. Different criteria for what constitutes iron deficiency, but one thing stands out. It's a really, really common problem in Asian women, exacerbated by cultural, dietary, and economic reasons. So when your control group of 50 women has not a single person with a low ferritin, then of course your cases is going to look like they have a statistically significant difference with regards to ferritin levels. The control group is unusually healthy, and in my opinion, it's implausible that this control group is representative of the average young Indian woman. I don't know whether there's an association between low ferritin and telogen effluvium. That's not the point of this video. If you're a patient who has concerns about hair loss, you should be talking to your doctor. I made this video because studies like these are common in dermatology. They are not properly scrutinized by editors and reviewers, and when they get published, they get promoted by hair experts and influencers who clearly have not actually read the study. And then patients are asked to take treatment based on poor quality evidence. And mind you, even if in this particular example, there really is an association, it still doesn't prove that taking iron is going to improve hair loss. This study is not an interventional study to look at the effects of iron supplementation on hair loss. So you see, even how we interpret poor quality studies is flawed. And I made it to illustrate the key point about how important it is to examine the control group in case control studies. Thanks for watching. If you liked the video, please hit the like button. If you have feedback or a different view, please add your comments and follow us on Instagram, Threads, Blue Sky, or X.